Well, in the vertebral column, your vertebral column, they're made of the vertebra, and they're like Legos. So you put a lot of Legos together and create your spinal cavity. So your spinal cord actually will protect inside. From the side view, curve a little bit, and the reason is it takes the pressure. So when you jump, the pressure can be absorbed. And you totally have 7 cervical, 12 thoracic, 5 lumbar, and 5 sacrum. But the 5 sacrum, they fuse together. They fuse pretty late in the late puberty. They fuse together. They become one, but they're 5. And 4 coccyx. These are the tailbones. Humans were very small, but some animals, they're huge. How to memorize them? I memorize them as you eat breakfast at 7, eat lunch at 12, you have an early dinner at 5, and you sleep at least 5 hours a day. So 7, 12, 5, 5. And you can create your own way to memorize it. So these are the vertebral column. So they create those curvature, and I tell you the reason is they take some pressure. So if it's completely straight, if you jump, the pressure gonna go to damage the vertebral column. And you also need to be able to identify the structure. So I will give you a vertebrae column and ask you, this is the cervical, thoracic, or lumbar? So let's take a look. First one, cervical. And I will give you this picture, not this picture. So it's easy to identify from the top view. The transverse section of the cervical, you found there are 3 holes. Every hole in the anatomy called the foramen. So the very unique structure, not just the spinal foramen, they also have 2 transverse foramen. And the reason is you have 2 blood vessels go through it. So every time I give you a vertebrae column, you find 3 foramen, and this is the cervical one. And in the test, I will give you a very standardized textbook one. I won't give you the one between the connect the cervical to the thoracic. It's confusing. I'll give you a very standardized one. Now let's go to the thoracic. Thoracic, you found, okay, 1 foramen. But you have 3 processes. So every time they're protruding out, it's called process. Go to the thoracic area, that's your chest area, and you have a lot of muscles. So these processes are muscle attachment point. And when you touch your back, you can feel your back, you can feel the bone, you feel this part. This is the spinous process. So you can touch your back and feel this. This is the spinal process. So when you see, okay, the body part, this connecting part. Body part is still small, 1 foramen and 3 processes. You know that's the thoracic. And now let's go to the lumbar. Lumbar, that's the area all your upper body weight put on it. So it has a huge body. It needs to support the body weight. So the body is big compared with the thoracic, that's small. Also 1 foramen and its processes more than 3. And the reason, more muscles attached there. So big body and more than 3 processes. So that's the lumbar. And when you go to the sacrum, sacrum is easy because these are the 5 bones fused together. That's the sacrum. And the coccyx, you have 4 coccyx, they fuse together. That's the tailbone. Now let's look at the ribs. You totally have 12 pairs of ribs. In the test, if I ask you how many pairs of ribs, and you start to touch your ribs, you count, you won't get it correct because you won't be able to feel all of them, especially the bottom 2, we call them floating ribs. Okay, so in those 12 pairs of ribs, the first 7 pairs, we call them true ribs. And the reason is they directly connect with the sternum. And the last 5, we have the true, we have the false. So we have the false ribs. False ribs is either they indirectly connect to the sternum or they don't connect to the sternum at all. So students usually get confused because the false ribs are actually 5 pairs, the last 5. And in those false ribs, the last 2, we call them floating ribs. And the reason, pretty obviously, they don't connect with the sternum at all. So you found some boxer, they hit the rib, they break the ribs. They're not breaking this. It's very difficult to break this. You can break this during the CPR, but it takes a lot of pressure. the box that talk about breaking ribs, they're breaking the floating ribs. And to make it worse, that's where your kidney is located. So you hit this area, you can damage the kidney, you can break the floating ribs. And let's look at the sternum. This is the sternum. Sternum have 3 parts. So if you look at the old textbook, you found they say you have 208 bone. The reason is they count sternum as 3, but most new textbook they count as 206. You say your body have 206 bones because they count all the sternum together. And 3 parts: manubrium, and the body, and xiphoid process. So three. So these are the ribs, and they connect to the sternum. So the 2 ribs connect to the sternum directly, and the false ribs, 5 pairs. The first 3 indirectly connect to the sternum, and the last 2 floating ribs. And they have different names. So the first 7 also called the vertebral sternal ribs, and apparently because they connect your vertebral column to the sternum. And the 8 to 10 is called the vertebral chondrial ribs, because they use the cartilage connect to the sternum. And the last 2 called the vertebral ribs because they only connect with the spinal cord, not the vertebrae column, the vertebral. Okay, now we go to the appendicular. So appendicular is your limbs, your upper limbs, your lower limbs. Students got confused. Is the girdle, the connecting part, still belong to the appendicular. So you have the pectoral girdle and you have the pelvic girdle. So let's look at the pectoral girdle. It's made of 2 bones, clavicle and scapula. And the clavicle, its function is connect your arm. Your arm is here, and to your sternum. So your whole arm, the only physical connection, your arm to your body is this bone. So and you found in some movie they found the actor, they break this bone, and it's actually pretty easy to break this bone because this is long bone and it's perpendicular, so it's horizontal, so it's very weak in the middle. You can break this. And you found, okay, those actors, they break this and they look like nothing happens. No, every bone in your body have a function. So if you break this bone, what happens is the weight of the arm gonna pull the arm down. So it turned out their arm dropped. They could not use their arm properly if you break the clavicle. And in the martial art, actually, they try to break this bone to disarm their enemy. So the clavicle connect the arm to the body, to the sternum, and it will connect to the scapula. So that's the scapular part. And let's look at the scapula. And scapula is a flat bone, so it has a lot of flat area called fossa. And in the posterior view, you have the supraspinous fossa, infraspinous fossa. In the anterior view, you have subscapular fossa. I highly recommend you to memorize those fossa, because when we talk about the muscle, and we'll talk about the muscle, muscle have layers. And the inner layers, you have 4 muscles. We call them rotating calf muscle. They're all small muscle, and their function is to make the arm move. And guess what's their name? Supraspinatus, infraspinatus. And there's another one here called teres minor, not major, teres minor, and subscapularis. So if you memorize those fossa, when we go to the muscle, it's much easier for you to memorize those muscles. And apparently those muscles called rotating calf muscle, their function is go to here, 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 and here, completely surround the head of the humerus. You connect your arm to your scapula. So we call it rotating calf muscle. And they're small muscles, so small muscles, they're easier to be damaged. Okay, so that's your arm, and we talk about the girdle part and the other bone. You need to know their name, your humerus and radius and ulna. And this part, they're pretty straightforward, so you know the name of these bones. Now let's go to the pelvic girdle. So pelvic girdle, you have the pelvic bone is actually created by 3 bones, and also the pelvic bone and the sacrum and together create a pelvic girdle. So the pelvic bone, also called the coxal bone, is created by these 3 bones: the ilium, ischium, and pubis. So these 3 bones, they fuse together so well, it's actually very difficult to identify the suture. It looks like one bone, and there's a reason they fuse together so well, because all your body weight are here. And in the pelvis part, let's look at this part. It's called the pubic arch. This is this angle, and this part is called the pelvic brain. This part. Why we talk about these 2 areas? If you like CSI, you found they can use the bone of the victim to identify it's a male or female. And the reason is they look at the pelvic bone. So the male is narrower. So you found this angle is narrower compared with female. And the pelvic brain, the distance is smaller compared with female is wider. And well, we know the reason. The reason is the baby, or the baby's head, and it goes through this. So the male is narrower and female is wider. So if I give you these 2, you can tell me which one is male, which one is female. Yeah, so this is male, this is female, this is wider, and the angle is wider. Okay, we go to the lower limb. So the lower limbs have all these bones. The femur is the strongest bone you have in your body. It's also the longest bone you have in your body. So also CSI, they found they can predict the victim's height. They use this bone to predict the victim's height. And the other bones, patella, that's the sesamoid bone, protect your knee, and tibia, fibula, and all the other bones. So these are your leg bones. You have the tarsal. Let's look at one tarsal. And this tarsal, this is called the calcaneus, and this is in your heel. So this is calcaneus. And you have tarsal, metatarsal, and phalanges. So these are the feet structure. And they also curve a little bit, and for the same reason as your vertebrae column, they can absorb pressure. So when you jump, the curvature can absorb pressure. Okay, that's it.